Hi everyone, welcome to our first virtual Lunch and Learn series. For this format's a little bit different than our usual Lunch and Learns, but for right now, just to keep everyone safe, we'll be doing everything virtually. So today we'll have a presentation from Dr. Hugh Babineau. He's one of our bariatric surgeons at the UT Health Tyler Bariatric Center. And we'll just be going over different surgery options and different things like that, just kind of an overview. So if you have any questions, feel free to drop them in the comments below. We will have a Q&A time at the end, and we'll try to address all those for you. If you decide that you'd like some more information on bariatric surgery, you can visit their website at tylerbariatrics.com. So let's get started, Dr. Babineau.
Okay, thanks, Brittany. Okay, so bariatric surgery, big topic. But first of all, what is bariatric surgery? It's a term that more and more people know, but what probably more people will call it is weight loss surgery, which is okay, but there's a lot more to it than this idea of weight loss. Bariatric surgery is a term that you'll hear, and another term that you'll hear is metabolic surgery, which is a good word because the idea is that we're trying to affect the overall health, well-being, metabolism of an individual with surgery. So that's the basics of what it is. Most people are familiar with some of the different procedures, and we'll talk about that. You've probably heard of gastric bypass, you've probably heard of sleeve or sleeve gastrectomy, bands, also known as lap bands, and there's others out there. There's something called duodenal switch or switch operations. So there's a lot of those to talk about too. So a little bit about why do we do bariatric surgery or surgery for weight loss at all? Well, the first reason is that obesity as a condition isn't good for you. That's pretty obvious to most people, but that's the starting point, is that like any other problem, any other health condition, this is a problem, and what can we do about it? So when we say obesity is a problem, what do we mean by that? Well, we know that it affects so many underlying conditions: diabetes, high blood pressure, sleep apnea, causes or worsens almost all of the things that Americans might see a physician for today. And so it underlies all of these problems. And we know that obesity is a risk factor for more problems as time goes on. So even if you don't have, say, diabetes or back issues or heart issues or sleep apnea, things that we can just directly or almost completely point to the obesity for, we know it puts you at more risk for developing more problems as time goes on. Plus, well, two things. One is problems as time goes on, but one is the actual mortality, lifespan. It sounds kind of grim to talk about that, but you may have heard this talked about for a while now, that the current generation of Americans being born today is the first in something like 100 years who, on average, have a lower life expectancy than their parents. And that reason is because of obesity and related conditions. So even that is affected as well. Plus, there's something that's harder to measure, like diabetes or blood pressure. We can measure those things on you easy enough, pretty objectively defined things. But how do you measure the impact on someone's life? They can't do certain jobs, they have less energy, they may not fit in the seats of an airplane, just the way it affects our overall lives and how we can function in society. So I call those the social costs of obesity, and those are real too. Is this about looks and looking better? Well, yes and no. I think that's part of why people want to lose weight, because as I said, there are social costs, appearance costs, clothing issues and things like that. That's certainly part of it. But then I emphasize that these really aren't cosmetic surgeries, in that that's not the primary goal of bariatric or metabolic or weight loss surgery, is to look better, to fit into a certain size clothing. I think that's all part of it, though. It's part of why people seek weight loss or bariatric surgery, and that's okay, because like I said, these have real social costs to people. And when we think about the head-to-toe individual, getting a person healthier, more functional in normal life, all of these things are factors there. So there's a lot of reasons why obesity is a problem, enough of a problem to look into it from a medical standpoint. So then the next question becomes, okay, if we can agree it's a problem, then what are we going to do about it? What interventions do we have to help with weight, to help with obesity? Well, we start with what people tend to call diet and exercise. Those are both words that I don't like very much for a number of reasons. If we have time, we can delve into, because Diet kind of to me means fad diet. There's always something. Try this. These 8 foods blast belly fat. You've probably seen things like that on the internet. No foods blast belly fat. Doesn't work, sorry. But when I say diet, I mean consumption, your activity, the calories that you do consume. That's always going to be the main point. Surgery, no surgery, medications, procedures, it's going to be consumption. What's coming in? What is a person taking in? We don't get obesity, we don't get overweight as an individual, as a nation, as a world without there being more calories than we need. That's just a basic fact you can never get around. So our consumption, you can call it diet, our eating habits really is a better, our eating, how we get into a system if we can for eating, that's always coming part. So diet and exercise. Well, what about exercise? I kind of have a problem with that too. That word tends to imply things like running marathons, doing CrossFit, all those things, all those are great. A lot of people simply can't do those things. But really what we mean is activity, because as a machine, the human body burns calories. So standing here talking to you, I'm burning a certain amount of calories. If I were sitting, I'd be burning calories. Just to stay alive, the human body is consuming something like 1,600 calories a day. But the more you move, yes, the more calories that you do consume or burn. And that's always going to play a factor too. But exercise as a way to lose weight, it is kind of sometimes overrated or overstated too. The reality is if you exercise just to lose weight but you don't change your eating habits or your eating system or your diet or whatever we're going to call it, people don't tend to lose weight. It's still good to exercise. The saying is it's better to be fit and overweight than to be unfit and overweight. So by all means, we want people as active as possible. But one of the reasons I emphasize that is a lot of people, especially with the weight-related conditions, aren't going to be able to jump up out of a wheelchair or toss a walker to the side and go run a marathon or something. So a lot of people are pretty limited in their activity. That doesn't mean they can't lose weight because, again, the dietary aspects of it are even more important. Okay, so I'm getting to the point of the why of surgery. I said it was because obesity is not good for you. The next point is that our methods to control weight aren't very effective. Now, again, we can say diet, exercise, etc. In theory, that works, but in reality, it works for a small number of people. If you look at the statistics, there's a number of ways to look at them. You can say 5 years down the road, if you've done a dietary intervention not involving surgery, so whatever you want to call it, diet, exercise, programs, and so forth, there's about a 2 to 3% rate of people keeping at least half the overweight off. So that's not a great success rate for interventions. If we have an intervention that succeeds only about 2 to 3% of the time, it doesn't work very well. Yes, we should always try to lose weight without surgery, without procedures, without medications. That's the least expensive and always going to be the safest way to go. The reality is that that doesn't work for the vast majority of people. So then our 2 reasons to consider bariatric metabolic surgery are going to be obesity is not good for you, and other interventions don't work very well in general and haven't worked for you. As most people know, you shouldn't just have bariatric surgery as your first attempt to lose weight. And that's pretty well given that people have tried, they've gone up and down, they've yo-yo dieted, they've tried different things. And that's pretty well standard. So yes, people should try, but most people aren't going to have success. And there's really no scientific or proven way to measure that. How many of what type of diet, this type, 6 months, 6 years, 1 year, none of that held up to any real scientific scrutiny. So the point is that people should have tried, and that's one of those personal decisions that a person makes about having surgery is have I tried? Do I know it's not working for me? So those are our basic points for why we do surgery at all. So how well does surgery do? Does it improve those comorbidities? Does it improve lifespan? Does it do better with weight loss? And the answer is yes. And the evidence is clear on that. It's looked at a lot of different ways. When you talk about morbidity and mortality, morbidity means problems, medical problems, mortality means deaths. Those type of studies have looked at large numbers of individuals. If you have a group of individuals who say met criteria, had obesity, severe obesity, morbid obesity, whatever term you like to put on it, didn't have a bariatric surgery compared to a large group who did, and you look at the morbidity, the mortality, so even deaths, complications, problems related to surgery itself, within 5 years, you have less of all that on the surgery side. So there's some good numbers out there to add up to say, again, just like any procedure, just like any surgery, where does it shake out? There are risks, everyone knows that all surgeries, all medications, all procedures, everything we do in medicine has risks. But overall, is it a worthwhile risk-benefit profile? And again, the answer on that ends up being yes. Still an individual decision because everyone, just like any surgery you decide to have, you say, okay, well, they told me the numbers add up and this makes sense for me. Do I feel comfortable with it? So that's another important part about deciding if you should have bariatric or weight loss surgery. So then surgeries do a lot better, like I said, in general, and a lot of things have been looked at, specifically diabetes, a lot of good research on that, just purely from a treating diabetes standpoint, randomized controlled trials, bariatric surgery, sleeve, gastric bypass, lap band, all of them do better than what we would call medical management. You've got diet advice on either side and monitoring. One side has had a surgical procedure, one side hasn't. You have far higher rates of curing and controlling diabetes than the side that does. And that's partly because anything that a person does to help control weight is going to help their diabetes. And so it's partly that these surgeries, since they're the most effective intervention for weight, indirectly are going to help the diabetes. But also there are some metabolic effects of the surgeries that aren't fully understood that have some actual metabolic effects on diabetes itself. Well, let's delve into the what about surgery. So that's our why and the what. How much time do we have for a Q&A?
10 more minutes.
Okay.
Yeah, speak up a little bit more.
Okay. So what on the surgeries? Well, these surgeries are different from other surgeries right off the bat. That's kind of makes them hard to talk about and hard to describe and understand. And in fact, I go as far to say is they're almost a backwards surgery versus a normal surgery. Excuse me. A normal surgery I think of as there's something diseased, there's something broken, sick, we need to cut out a tumor, we need to put a broken bone back together, there's something that we're going to go in with surgery, we're going to fix it, remove it, we're going to hope that you recover and go back to normal without any side effects. So when I say a bariatric or metabolic surgery is backwards or not normal that way, it's because the stomach organ, what we actually operate on, is a normal functioning organ. There's nothing diseased or wrong with the stomach itself. And so we go in with surgery, we change a normal organ, we now make it abnormal. We hope you do have some side effects that you don't go back to normal or usual again, which makes it opposite from a typical or normal surgery. Now it's those changes though, those side effects, how your body reacts to food, how you feel when you eat, what types of foods you can comfortably eat, types of foods you may not be able to eat at all, just how much a person can eat. All of those affect your weight, which affects your health, which helps get you healthier. And so we're still going for the same goal with surgery. We're trying to get someone to a better normal state of health, but it is kind of indirect how we go through it. So when you're trying to get a weight loss surgery, what you're trying to do is you want something that's drastic enough to get good enough results to make it worthwhile, but then it has to be gentle enough, if that's an okay word to use about surgery. It has to be, it has to leave a person's stomach and intestinal system still working well enough to digest and absorb and get normal nutrition and food in. So every surgery, every procedure that we try is trying to balance those two competing goals. And as we go through the different types of procedures, and it's oversimplifying a little bit, but basically they go from you've got less surgery, less drastic, less risk, to more surgery, more risk, to less weight loss effect, less metabolic effect, and so on. So that's the general trade-off as we look at the procedures and the surgeries that are out there. So right now, there are 4 surgeries that the American Society for Metabolic and Bariatric Surgery, the ASMBS, has endorsed as standard procedures, meaning that enough research and experience has been done with these, that there's a general support of them. There are a number of different other procedures in this country and in other countries, different variations on it, but we focus on the current 4 accepted standards, and those range from kind of in that order that I was talking about earlier: less surgery, more surgery. You have adjustable gastric banding, lap band. Then you have sleeve gastrectomy, also known as sleeve. You have gastric bypass, also known as Roux-en-Y gastric bypass. There are other variations like a mini gastric bypass that aren't standard variations on that. So you have a Roux-en-Y gastric bypass, and then you have something called a duodenal switch, also referred to as a SADI or a loop duodenal switch. So those are your 4. Lap bands are not very common these days. They came out in 2001. They had reached a level of about 50% of surgeries nationwide were lap bands, and then that really slowed down, so they're a lower percentage now. Sleeve gastrectomy is about 10 to 12 years old as far as being a mainstream operation. It pretty rapidly became the most common surgery, and still is the most common one today in the US. About 90% of people in the US today get either a gastric bypass or sleeve gastrectomy. And within that, it's about 2/3 sleeve gastrectomy to 1/3 gastric bypass. And then I mentioned at the other end, also not very common, maybe 5% of surgeries today are what we call the switch operations, the duodenal switch, and those related ones.
You want to jump in for some question and answer?
Yeah.
Awesome. Okay, so the first question we have is, how long is the typical recovery time?
Okay, so recovery time, there's the hospital time. Except for lap band, all these procedures are done with at least a 1-night hospital stay. We tell people prepare for a 1 to 2 night stay, although most do go home after 1 night. Then you're home, you're not needing home care for most people. Person can take care of themselves, but really any job, we say at least a week off on that. Now, depending on what type of work you do, it can be as little as a week for some jobs. 2 weeks is probably the most typical. If there's something real physical where a person has a lifting requirement, say 50 pounds lifting, it may have to take as long as 4 weeks.
Okay. Are there any age restrictions for surgery?
That's a good question. This varies from bariatric center to center. We currently accept as low as age 14 and up to 80, and all of those then are very specific. As we get into the 70s or in the teen years, those take specifically looking close at, but we have a pretty broad age range potentially.
Okay. Another question is, they're asking about excess skin removal.
That's a great question. When people lose and keep off a significant amount of weight, there's going to be loose skin. And how much it's a problem, it's really going to vary how much a person lost. It's going to vary their age. Just genetically, some people have more stretchy skin than others. But if a person keeps a significant amount of weight off, there's going to be some loose skin. Now, what can you do about it? There's really nothing medical, nothing you can put on. I'd love to trick people into more exercise and saying if you did 1,000 sit-ups a day or something, you could shrink that abdominal skin, but not really. No, it doesn't do that. Unfortunately, skin does what it's going to do. A lot of people, in reality, end up living with it, clothing, and dealing with it, because really only true way to get rid of it is surgery, plastic or cosmetic surgery. Sometimes some insurance plans will consider what's called paniculectomy, the actual overhang of skin in the waist or the lower abdomen area. Sometimes some insurances will consider that medically necessary, and that can be removed.
Okay. One question that came in is asking, what are your opinions about Saxenda for long-term use?
I am not much of an expert on the various medications. So I will have to pass on that one.
Okay. Another question is, what are the options for reversible gastric surgery?
Interesting question. I saw that on the list. So, from a technical standpoint, from a surgical, technical, anatomical standpoint, a lap band can be reversed, meaning it can be removed. A gastric bypass can be reversed. You can put the pieces back together. It's a pretty serious surgery. We very rarely do that. Now, a sleeve gastrectomy cannot be reversed because we do permanently remove about 3/4 of the actual stomach. And because a duodenal switch is a sleeve gastrectomy plus an intestinal bypass, you can partially reverse a duodenal switch, but not the sleeve gastrectomy part of it.
Okay.
Now, I have to jump in on that because when people ask that, sometimes I would ask, well, can I get XYZ procedure and then when I've lost all the weight, get it reversed? And the problem is, yes, technically you could, but you're the exact person that we would not want to reverse, because if you do reverse a procedure for whatever reason, and typically we do it if there's a problem. Again, any of the procedures can have a problem where our only solution is to so-called reverse it, but unfortunately what happens is that people gain the weight back. Whatever weight they had kept off, they gain back.
Okay. So going into that, or kind of coming off of that, how do you prevent regaining weight and keeping your metabolism going?
Well, that's a tough one, and that's one of the hardest points about bariatric or weight loss surgery is that it is a lifelong management issue to keep the weight down. You know, we talk about bariatric surgery to think of it as a tool. Like any tool, you have to use it. And so really our biggest issue in these surgeries is how do we keep the weight off? How do we get down to a lower weight that we want to be? And it is a tough one, but it does come down to, in general, our friends' activity and consumption. I avoided saying diet and exercise. Like anyone else, the idea though is if someone's had bariatric surgery, you do have those changes to give you some advantage on it. And so it's really getting back to the basics, getting back to the guidelines that we give everyone, which really aren't that different from what we tell anyone, that we try to eat foods that are high in nutrition, low in calories, lean and green, avoid liquid calories. You can get a lot of calories from drinking regular sodas, sweet teas, and the surgeries don't really stop that. Some people don't tolerate those things very well. So with everything, it's taking a look at what is your consumption, what is your diet, and just doing a food journal. 2 weeks, write down every single thing that you eat or drink, and even just sometimes that measure of accountability, sometimes people actually start consuming less. So it's just going back to the basics really on that.
Mm-hmm. Awesome. So another question, let's see. How do psychological bariatric evaluations help your team determine who's a good candidate?
Good. Well, those really help us in a couple ways. One, I think they help us establish a baseline, because we talk about the various medical surgical risks of surgery, and everyone knows about bleeding or infection, surgery risks like that. But there are emotional risks to these surgeries. In the big picture, I think people find it's worth it as they get healthier, but there definitely can be ups and downs getting there. Food is a huge part of everyone's life. It's part of socializing. So a bit of a baseline. If someone has trouble afterwards, we've established with at least one provider that way, and I think that can be a useful part of it. And it's a little bit sort of like getting an echocardiogram or preoperative blood work. We want to check on someone's psychological, emotional health as well and see if there are any major concerns. Again, if we found a heart blockage we didn't know about, we would work on that before we did surgery. So that's really the other purpose on it.
Okay. So we're going to do one more question and then we'll wrap it up. One of the questions that came in was asking if it's okay for someone to get pregnant after having surgery.
Well, definitely yes. And many people do have improved fertility after weight loss. So what we counsel people is that we don't want to get pregnant at least a year, and ideally we want to be at level weight, and we've been good at taking our vitamins and things.
All right. Well, I think we'll go ahead and wrap it up.
Okay.
Everyone, thank you so much for joining. I know we had a little bit of audio problems. It was a little bit hard to hear, so I do want to let you know we're going to work on the video and re-upload it and kind of bring that audio up, so hopefully we'll have a better file and you can find that on our Facebook page a little bit later. If you have any additional questions, feel free to visit our website at tylerbariatrics.com. Thank you.